I think we're ready to start. So opening the meeting of the Montpelier-Roxbury Board of School Directors at 6:38. First order of business is public comment. Hearing none. Consent agenda. Do you have a motion to approve the consent agenda?
I move to approve the consent agenda.
Do you have a second?
I second that.
All those in favor?
Aye.
Is it okay that it just says resignation, so we got a new one, do we have to do something different, or it just falls in there?
I think it falls in
Good,
there, yeah.
okay.
Actually, I have a question on one item in the consent agenda.
So do I.
Before we,
Okay.
We take back that.
Went too fast.
Forget it.
Well,
It's not effective vote, however.
Yeah.
But Andrew, go for it.
I flagged something, there was an issue with something in the minutes. Anna, is that corrected for this version?
The attendance for the finance committee?
Yeah.
No, it is not corrected in the current packet you have, but will be corrected.
Okay, does that require any action from us? I don't know. The only change in the minutes is I was not present at the finance committee meeting, and Anna's gonna correct that.
You were there in spirit.
That is true.
Right, is there anything in there around?
Ghost?
But anyways, minor thing, but that was,
So it's I think it's clerical error too.
It's clerical, it's typographical, it's not a big deal.
Yeah,
okay, great.
our parliamentarians
A
views.
really
That's fine.
easy question,
I haven't. What?
maybe an easy question. It says the first day of school is August 24th, but then August 24th has this funky box around it, and I don't know what that means.
Oh yeah, see first and last day of school. Is that the funky box?
That special
Yeah,
box, I didn't see that legend.
yeah.
Never mind, thank you.
Sienna, is
Change
that-
is in response to EDA compliance and visibility on their website, just so you're curious why the change from all colors.
It's a better system.
I'm glad you said that though, Michelle, because we're starting on the 25th and ending on the 16th. The one that's in here is the 24th and the 15th. I'm glad you said that, Michelle. Well, that's with the 3 days,
So we should,
first snow days.
So this
should
calendar
not
is
be
incorrect.
approving this calendar
No,
So
you
this
should not be
can-
approving this version.
that we
Okay,
already approved?
we haven't approved it, we haven't voted.
No, we did vote.
We did vote.
Sorry,
should
you
do
put it the
it.
wrong
Yeah.
one.
Should do some
Yeah,
kind
you
of
put it in the wrong
parliamentary
one, sorry.
unwind.
Yeah.
We've got enough mess here, maybe just to what's the process for,
Unwinding.
there is.
Unvoting?
Can you move to,
Reconsider,
yeah,
move to.
Let's reconsider the consent agenda.
I move to reconsider the consent agenda.
Second.
All those in
I'm so
favor?
glad you said that, Michelle.
Okay.
Okay.
We went through multiple versions of the calendar, and the one we ended on is starting on the 25th and ending on the 16th.
And is the 24th a teacher day?
24th is an open day.
The 24th and
Nobody
25th.
has to be anywhere on
Right.
the 24th?
Right.
Okay.
I have
A lot of
two-
teachers will use it as a discretionary.
I have two suggestions. I mean, one is we can put off approving the calendar until our next meeting if it's not considered urgent. But I do
No,
know
it's
that
not
people,
considered.
well,
It is
there are
very
parents
community,
already
yeah.
asking about it. We could, if it's possible to generate the correct one while we're doing other things in the meeting, we could come back and revote
I
the
have got
calendar.
it.
I have it at my desk, yeah, I just happened to put in the wrong one.
Oh. I'd be inclined to try to revote the correct calendar, given that people are already asking about it. Jim, if you feel like that's.
It's just
Yeah.
that one little mistake.
Yeah,
Can we approve it with that change? And then we're done and everybody has some concrete planning skip tools?
You mean approve it without seeing it?
Well, is it just the one change?
It's, well,
Two.
two
Is it
changes.
Start and end.
First
Start and
and
end
last
date.
day.
I don't mean to cause more trouble, I'm thinking the more concrete we give families as soon as possible, the better, that's all.
Well, she was suggesting that you just bring us back the right one in 20 minutes or
Oh,
something.
even better, I was thinking next week. That's fine.
Okay.
Sorry about that.
Bridget still had a question.
Mhm.
yep.
So my question about the minutes was just more general, and I meant to bring it up last week and forgot, and I just thought I would bring it up since Andrew brought up a question about the minutes. I think there's been a number of times where the minutes recently have said things like the board agreed.
Is what?
In, have have used language in the discussion along the lines of the board agreed, or it was agreed, and I think we have to be careful about that in the minutes, cause there really isn't any board agreement unless we take a vote on something.
The minutes as they are far more detailed than they need to be. The minutes really just need to be a record of decisions
Yes.
made.
Agreed.
And I know that it's nice for transparency to add more, but as you add more, you bring in clarity.
Yeah, Anna just needs that feedback, she just never took them before.
Yeah.
Yeah, that's all.
I would say though, even though you're only recording the decision, sometimes we've had a discussion and then later on, we try to think what we had the discussion about and we can't remember. So if there was some two-liner that said something about the discussion, I'm trying to suggest an in-between.
It would be more
Just-
like a discussion occurred, is that what you mean?
The
Right,
board
board
discussed
discussed.
X.
Yes,
Yeah.
like the board discussed the data regarding gym usage and questions raised by the community about gym usage, and there's
Not a
There's many
transcription
levels
of the
of
discussion, but.
discussion you could
Yeah.
get to, but when it gets to the level of it was agreed, or the board considered
it's
this,
a
or
very good
viewed it
point.
this way, it's going, I think, beyond what you could put in the minutes if there's no vote.
And sometimes I know, like, it'll say, like, Steve Hinchin said this, and I feel like that's nice to be on the record, but it really doesn't matter what's being said by any one member in the discussion, because it has no weight.
And plus, then you really feel like you need to read it.
Right.
Make sure you record it.
That I really said
Let's get
that.
to the real issue here, Michelle, as she leaves the board.
Well, and we have recordings on file
Yeah,
of the.
yeah, there are videos.
So there are
if we need to go
videos.
back to some issue, we can go
Yeah.
back to it.
Yeah.
I can give her that feedback,
Less is more.
Easier for her.
much
Yeah.
easier for her.
Yeah.
Yeah,
Yeah.
'cause she's typing like mad.
Well, you might just give her examples of Heather's minutes too, because,
Mhm.
Which were actually also overly detailed,
but,
not as much, so.
Mhm.
yeah.
That's fine.
But I do think it is good to note at least discussions, because sometimes when I have, sometimes I have one
Forget.
vote,
Right.
you know,
Even you
in a
young
meeting.
people, forget.
Uh, Okay, so that's not an action that needed, it was just a comment.
So do you want a motion to approve the consent agenda without the calendar, or do you wanna just redo the whole consent agenda when we get the calendar back?
Let's do a motion to approve without the calendar, and then we can approve the calendar when it comes back.
I will move that we approve the consent agenda without the district calendar.
I'll second that.
All those in favor?
Aye.
Aye.
Any opposed? So here's on a vote, if we don't get, cause I stopped it, I didn't say any opposed the last time, that's still a vote as soon as you have a majority, even if you don't complete the vote.
Oh, I thought you had done the whole thing last
I
time.
hadn't gotten the days.
Oh.
Huh?
Oh.
So we got off the vote, so.
But it was a unanimous aye until people started saying, hey, wait a second.
I didn't mean that
Yeah. Okay, we will approve the rest when it's back. Monitoring reports.
Yes, so we have 2 monitoring reports. Travel reimbursement, the ever exciting one.
Most exciting.
We're following that policy to the T, in fact, I think more to the T than it actually needs to be. And participation of home study. Pull that monitoring report. I'm happy to take any questions about that the numbers are there, which is part of the policy, that we have.
I have 2 questions.
Go for it.
On the second page about participation of home study students, number 3 says students must participate in the following 3 areas.
That's like saying, these are, if they want to participate, these are the areas of participation allowable.
Oh, okay, it reads like
They
I
have
have
any home
to-
study kid.
anybody
Sorry.
that wants to
Mhm.
participate must take phys ed, health, and fine arts, and I knew that couldn't
No,
be true.
Definitely
Seems like it
says
Those
should
are-
say
yeah.
student.
It's
may
more like
participate.
choices. I can fix that up, next time. Cause I can understand how it reads that way.
And my other question is a curiosity, which almost all school boards ask, which is, do we know why these students are homeschooled?
No.
Okay.
No,
I
we
mean, how
don't.
would we find that? Seems
Well-
sort of intrusive.
It is, but sometimes, there's an underlining reason why more students would choose not to be in the school but somewhere else. And clearly we don't know one, I'm just asking.
I'm curious, maybe a ballpark idea. So these are home study students.
Mhm.
Do we have any idea how many students are outside in other placements, like a Catholic school or another private education?
I can get that number for you. I don't know it off the top of my head, but I can get that number. I believe I can get that number for you, maybe.
Okay.
I don't think they, actually, maybe I can't, because they don't have to register with us if they're registered in a different school.
Sure.
They're not, these are still they have to register, we have to have them on, or they have
So
to
that we can
recognize
ensure
that they
that
are
something is
or their
happening.
resident school
Mhm.
if they're home study, but if you go somewhere else, I don't think you do.
Okay, Bridget?
So these numbers reflect all of the students in the district that registered with AOE as home study students, whether or not they are engaging in a district,
Right.
in any district activity.
Right.
I just wanted to make sure I understood that.
And then the number
somewhere it
below,
says
Main
you
Street
say-
Middle School has one home study student taking PE.
And that's the only one of these that are involved in the school, was my
Yeah,
assumption.
last year we had a few more at high school, but we don't have that this year.
Another thing about homeschool is they have the ability to participate in our co-curricular, is that right?
Yes.
Do we have any record of the numbers of homeschools who are using our athletics or co-curricular programs?
I don't know that number. I
Right.
don't believe, I don't,
It's not a lot.
yeah, no. I don't know that number.
And then, it's not by any means urgent, it'd be interesting over time to track some of these things longitudinally, like over time to see whether our numbers are going up, down,
Well, we
staying the
will with the policy monitoring,
Right,
you know,
as long as we
because,
keep it all the same, yeah.
yeah, because I have the same policy monitoring from last year, so we most
Yeah.
definitely will be able to do that. It's
Actually-
part of a policy that I have to show the
Yeah.
numbers each year.
I was gonna say, it might be interesting to see them column-wise, so last year, next to this year, next to
Oh,
next year, you
yeah.
know what I'm
I
saying?
mean, we
So
have
you can see the
2 years of
trend.
data,
Yeah.
so, but, and then the other is, I think AOE probably keeps track of students in private, right?
They
Even-
might, I don't know.
I don't think so.
They must know, because they're, how many students are enrolled in these authorized educational facilities.
But they
And
might
they
not
would
know it by
have to-
Number,
Right.
but they
Count.
might not know
Truancy.
that they were from Montpelier.
Because all students ages 6 to 16 are required to be in school,
Yeah.
and you've
Yeah.
gotta know
Yeah.
where they are.
These are all excellent questions. I do not know the answer to.
They should know other schools as well.
Hmm?
They should know other schools as well, too.
Right, that's what I'm thinking.
Right, but I wonder where there's a list of Montpelier resident people
6 to
between
16-year-olds.
6 to
Yeah.
16.
That's beyond child count. We get in here.
Right, I'm not sure there is one, is what I was
Right.
thinking. We had this in relation to why, or we had this discussion once at the board about Catholic schools and private schools and whatever, is like, wonder why someone would choose that, so I was
Is there-
asking sort of the same.
Is there a way of finding out? Otherwise, we just have numbers.
Yeah, but you really don't have a
Yeah.
way of knowing unless something comes up that the superintendent might know that I wouldn't. That would be, she's had 4 or 5 people come in and say, I'm going to such and such because of X, Y, and Z.
Yeah.
Which has not
But-
happened.
Right, I assumed that,
Do we have a motion to approve any further discussion? Do you have a motion to approve the policy monitoring reports?
I'll make the motion to approve both the policy monitoring reports.
Have a second?
A second.
All those in favor?
but.
Aye.
Any opposed? Great, policy monitoring reports approved, and learning focus, so Eve?
Yes. So today Hope isn't here, so I'll just be saying some things around some things she wanted me to add. So for student celebrations, we have The very first Black Lives Matter flag has been framed in the main lobby along with the testimony given to the board. And this is just to remind us of the day that MHS raised the flag and the importance of continuing to spread the message and education behind Black Lives Matter. And going along with that, the RJA has decided to hold affinity groups, which are basically like small group meetings after school for students of all races, just to continue to talk about race issues and to foster more diversity and inclusion and maximize the impact. Club
You want to
Interact-
explain what RJ is? In
Okay,
case anybody doesn't.
it's the Racial Justice Alliance. It's basically.
And Main Street Middle School is raising the flag on Friday morning.
Oh, that's great.
Yeah.
Yeah, so Club Interact students cooked food for the warming shelter last week and volunteered to host, so it's good to see students getting more involved with the community and stuff. And for student issues, I've talked to a lot of students, and a large concern is the current health curriculum. And it's kind of hard because health is a very wide topic, and it's hard to be inclusive and get education for everything you need to. And but currently the big issue they talked about was its pro-abstinence in the health curriculum currently, and there's not a lot of discussion on safe sex and safe LGBT sex and birth control options, which is really important when you're a teen and you're growing up. And it's very important to make it more inclusive, and I know that they're trying to do that, but there are ways that we could strive to be better at doing that. And we just want every student to feel safe and have a good sense of belonging and know about safe sex practices and mental health issues. Another issue is students leaving food around the school, which I know Renee tried to address, but there was some backlash with that. Yeah, but some students have expressed concern with not feeling comfortable in the school's cafeteria, so I think it would be good to have a group of students brainstorm some ideas of making it a safer and more comfortable place. And the last thing Hope wanted me to add here was Lindsay Hallman with Up for Learning will facilitate youth-adult partnership retreats with MHS and MSMS students and teachers who are working on restorative practices. And yeah, that's all I have.
Questions for Eve?
Yeah, the cafeteria, you just mentioned some students don't feel safe there.
Yeah.
Can you expound upon that without putting any students in
Right.
uncomfortable?
I think it's just very like cliquey and stuff, and a lot of students feel that they don't have a place where they can comfortably and like safely eat without feeling like they don't belong. And it's like an ongoing issue, and I know it's like obviously going to happen cliques and stuff, but I think there are definitely ways that we could improve on it instead of students feeling the need to not eat in a place where they should feel safe too.
Are there any solutions out there bouncing around?
Yeah, not yet. That's why I think it would be good to like organize a group to discuss things about that.
Do you think a student-led effort would be the way to drive a solution, or is there any, I'm just thinking from a board member's perspective, it's something I'm concerned about, but I'm thinking about where's our angle here versus where's the student's angle, teachers,
Right.
administrators.
I think definitely starting with like a student group and then generating ideas and then moving off of that.
There are big tables, so if you come into the cafeteria, you have to choose to sit at a table,
Yeah.
which might not have people you want to sit with, or might not have people sitting at it that want you there, right?
Yeah.
That's an issue.
We had a former administrator years ago who made the observation that when he was hired, people welcomed him and said, "You're gonna love MHS because there aren't cliques." And he was like, "That's ridiculous. There are cliques everywhere." But then what he observed was that there's like one huge clique because you guys are together and have known each other forever. So like if you can fit into the big clique, like everybody's pretty friendly to each other, but if you don't fit into that big clique, you're really stuck outside.
Right.
Is that
Yeah, definitely.
inaccurate, yeah. And so the challenge for all the time that I have been aware of this is how to create an inclusive environment for those kids that can't get in. It's tricky because they're all different it's not like one group that's excluded, it's the kids around the edge that can't get in.
That are really isolated.
Well, the physical makeup of the cafeteria has a lot to do with how people feel comfortable. It's true in the middle school too, it's the same issues to some extent. So, that the reconfiguring, if necessary, of the physical space can make a difference.
Or maybe new furniture.
Well, that's maybe what it takes, but it takes some thought. I mean, it's not just break it down into little tables.
Right,
There's more to it than that. I had a question about the health thing.
Yeah.
Well, maybe about both things. What is your avenue, these issues are great, and they're issues we've heard, for a while to some extent. And I'm wondering, do you feel like you have an avenue to talk to the principal or have an impact when you feel, for instance, the health curriculum is something we are talking about and the administration is focused on a little bit, and there's like and it's in the middle school, so it's not a new concept, but where is your ability to influence that at the high school? Where do you feel like you can actually insert your values or opinions?
Yeah, I feel like a lot of students have these opinions, but they don't necessarily know like what to do with them, so they usually just keep it to themselves. But I feel like if we establish a good person or place that they could talk about these issues, people would definitely like organize themselves and find solutions or ways they would like to improve stuff. Because the health issue, I noticed, only came up between like other students, and they don't really know where to go from there because they just accept it. So I think just establishing a good person, like a faculty member, would be a good solution to that.
Is the health curriculum in high school, is it the class in ninth grade?
There's a class in high school.
Right, there's the one that's often taken first year. Is there another required health class, or is
No,
it just that one
there's just
semester?
And is that the health class you're talking about?
Yeah.
Yeah.
Is there integration between the health curriculum in the middle school and the high school? So that there's a flow?
Right now, we have a health curriculum committee with parents,
Yeah.
Planned Parenthood, teachers on it. That's Mike Berry's leading.
Yeah. So it's
It's
in the
in
works.
process.
Yeah.
And so what is the current curriculum and what does it, and it's a big question, but like, where would we go to find out what exactly is being taught? Because when I hear.
Here in the high school would be the program of studies.
Yeah.
In the middle school, we're working on that. There isn't any formalized document.
And like, what does pro-abstinence mean?
You'd have to look at the program of studies and ask the teacher, because I don't know enough about it from the pro-abstinence perspective.
Is it like part of a menu, or is it like the preferred option?
I have not been there during the class. I don't know, because I have not been there during the class when the conversation is happening.
Oh, it's been a while for me. 3 years. I talked to some freshmen who were in the class in my TA, and yeah, that's basically what it is.
I don't know about high school, but I do know, even though it was a while ago, about middle school, and this is a hot button issue, not only for the students, but the parents, because parents differ greatly on what they think you should teach or not teach their children.
Absolutely.
Yeah.
Yeah, but they're not all evidence-based.
Yeah. I mean,
I'm just saying, it's just a hard
I've had
discussion.
5 meetings with parents about curriculum, all of them around health, none of them around reading, math, science, or social studies. And all 5 of them had a very different perspective of what should be the focus in health, depending on where they were coming from and what their student is experiencing in their life, not in health class necessarily,
Oh, I
but
see.
in their life,
Right. Very
Yeah, that's-
personalized for what's working.
Right.
or what's needed for individual kids.
Yeah, right.
And health is just really one part of it. You and Mike are really looking to kind of re-envision how curriculum is oriented within our district. I don't know if you wanted to touch upon that while we're on this subject, just
Well, when we took over a year and a half ago, there was no curriculum. There were a program of studies that, at the high school level, that may or may not be connected to the standards we're required to teach. The middle school, again, had something written down in multiple Google Docs, not in one area, like you couldn't find it if you wanted to find it. And again, it may have been connected to standards we're required to teach, but most likely it wasn't. There's nothing. So we focused on math first because that's a relatively easy,
Yeah.
right, curriculum
It's
to
linear.
target. We're working on reading slowly and health right now. We are also working on PE, art, music, that the specialists right now. Because we can target those teachers in a different way as classroom teachers, so we're targeting that work. The health got pushed to the top because of the demand from community. I think our reading curriculum might need to be pushed further up, but that's not the priority right now from the community. The community is the health curriculum. We don't have a lot of time in health class, and if you add more time, what do you take away is a big question. Again, I've had 5 meetings, and each of those 5 meetings had a different perspective, either mental health or solely LGBTQ+, or solely sex and consent and that kind of thing, or solely not sex in any way, shape, or form, or drugs and alcohol. Those are the 5 biggies. So, and each parent was equally as passionate in their argument for whatever their cause was.
We also had a group of students come to the board asking for changes in the health curriculum.
Yeah. So Mike's working on it. He has the committee together. He meets often with them. Anna, like once a month is he working now, or twice a month? I feel like he's working on it quite a bit right now.
The health curriculum team, which there's lots of things been happening, but that one is forming, the group is forming, it's just been identified who's in that group, and their first meeting will be.
He's been meeting individually with the members of that team for the past 2 months to get people's perspective and get them relatively in the same boat, rowing in a direction.
On the other hand, Mike has nice piles of.
Yeah, you see all that?
Yes, so it's not health, but it's, math.
We're formalizing it, we're working
Yeah.
on it. It's a big haul. There's a lot of work to be done in the curriculum area, which is one of the pillars we stand on, that we need to stand on.
No, and health is very important and it's very tricky, but like all 5 of those issues you just mentioned are things that are still relevant in my daily life, and I can't tell you anything about calculus, so.
Right.
So.
True.
But we're
Even though I
glad you
got
can
that.
read.
Huh?
But we're glad you can read.
I can read. But what I read in 9th grade English, I couldn't tell you that other thing, except I think To Kill a Mockingbird, but it was very important. I'm not diminishing reading, because we do need reading curriculum, but it touches
Yeah, you're right.
really important things that carry through our lives, so.
So does
Everything else.
financial literacy, so does,
Yep.
there are other things too that are not requirements either. So it's not an easy
No.
conversation when you got a packed schedule in a small school.
Yeah.
So is the issue that we haven't, as a community, come to a consensus over what percentage of our day we want to spend on it? Because it feels like, I'm feeling some pushback from you, and I think that's healthy, but what I'm saying is I feel like you're feeling it's taking up too much space, and I don't mean that in a bad way, because I think that we have to always find those balances. But I want to be careful because there's so much concern from students and parents
Mhm.
about this being a high priority for them, so.
Which is why it's moved to the top.
No, I get it, I feel like you're respecting that, but what I mean is, you also, there's feel some tension there from you, and I just.
There absolutely is tension in
Yeah.
the sense that we don't have the time in our schedules or days to truly do justice to all the pieces around how to have a healthy life in one class or in one middle school section that they do twice, I think, in middle school.
But Libby, so I've had 2 kids go through all of the maximum amount of health education you can in this district, and there is a lot of room for improvement
Absolutely.
within the time available.
Yeah,
Absolutely,
that's what
totally
I
agree
think
with
the
you.
issue might be.
Totally
is-
agree with you,
We're at
Michelle.
Nowhereville
Is
here,
it-
so-
Totally agree with you. And what I've talked to Jim about is that there's a difference between curriculum and pedagogy,
Yeah.
right? And supervision and evaluation
Both,
of said
all
pedagogy.
that
Yep.
stuff
Yeah.
is-
Yep, absolutely. I totally agree with you.
Yeah, I
I
mean,
mean,
that's,
so Libby, hearing the concerns that you brought forward and listening to, what the parents are bringing to you, it might not necessarily need to be more classes, but maybe more avenues for the students to access quality information source. I don't know if it's more guidance counselors or social workers or a health instructor, like an open office that somebody can come into and have those very specific questions on whatever the myriad of health concerns might be in their life right then.
Yeah. And U32 just took up birth control like a month ago. I'm actually testifying at the Health and Human Services tomorrow around a bill that's coming about around birth control and requiring secondary schools to have it available, available to students. So I'm testifying on that tomorrow. We don't have currently contraception available for students in our building. So that might be something this board wants to take up, or wait until to see what the HHS decides on this legislation, which might be smart because it's coming your way anyway.
well, and, I mean, because I get the sense too, that the quality is as big, if not a bigger issue than the quantity, the time we spend on
Yep.
it. And also, kind of going to reading and literature and to, science and other things, a lot of those subjects touch on these issues in various ways. I mean, I wonder if there's a way to, there are certain books you read that have themes that touch on, sexuality and health and alcoholism and, not that every teacher needs to be prepared for that, but, looking for those opportunities to discuss tough issues outside of a health class.
And
Some
they
teachers would
do,
tell you they don't have the
actually.
training to discuss that.
I think that might be correct, but,
But I think they do. It's just not perceived as health instruction
yeah.
by the community or students necessarily.
Yeah.
Like they read Speak in ninth grade, which is a book that talks about sexual assault, so they talk about that.
Yeah.
Although when my daughter was in ninth grade, the boys were given the option to read a different book.
Well, I mean, those are the type of things that,
Hopefully that's no longer
yeah,
happening.
Yeah.
yeah.
I think in fairness to you too, I heard two areas of concern. One is, how much of the day do we want it to take? But the other is just that there's a lot of curriculum that needs to be worked on right now. So
Yeah.
in terms of squeezing other things out, it's not the curriculum itself, it's the development of the curriculum that's squeezing things out right now. And that makes sense, right? It's like, well, what about reading? Shouldn't we be working on that at the same speed? So I'm not trying to be critical of all. I know you're balancing. I'm just saying, I just want to make sure we all are heard around, and I know we are, is that the community is like screaming for this, right? And it's I think quality, I think they got it right. It's not time, it's quality. So.
But another thing that Libby did just say, and I do not envy your position on this, is she's hearing from parents on polar opposite ends of the spectrum, and whether it's evidence-based or not, sentiments are very strong on both sides of this, and Libby's in the middle, just,
Yeah, it's hard.
Good luck, Libby.
Thanks.
We're here for you.
And
Tell me
schools
more
have
about
been
that.
for
Help me understand.
generations.
I mean, beyond us just wishing you well, I think I have said this before on this topic, and I would say again, we often tap the reserve fund for one-time expenses related to buildings, but there's no reason that we can't tap our reserves for one-time expenses related to curriculum development. So I feel like if
Yes.
there are, we can't clone Mike, but if there are resources that could be brought to bear to help the crunch on curriculum development, I
Maybe
would want to hear that need existed. If
A
there was a way
consultant.
to
Or
address it.
maybe
Yeah.
summer work.
Right.
Yeah, that's
Yeah.
planned. It's just getting the right people at the table.
I wish you luck.
Yeah, I would support that too. Well, not that I'm relevant anymore, but
Right.
a consultant.
But you're relevant right now.
For the next
A couple weeks from now, not so much.
The next time this comes up. So, back to the cafeteria for just a second. There must be, schools that have solved this or done creative things about it that have models of, you know,
Yeah, the
cafeteria
cafeteria thing, as
innovations?
Eve alluded to, there was, Renee had a bit of an email snafu.
Yes.
She'd probably know. And while that was a mistake, that I won't really get into right now, the sentiments that she learned from it were really important. And
Yes.
what Eve is bringing to the table here is what we learned. She learned from it, right? So she's well into how do we solve this problem right now? Like what do we need to do to solve this problem? And she's not backing down from it. It's almost, it's not to say like we were ignorant of it, but it really came to a head when she sent an email that she didn't mean to send. And that's a good thing.
Yeah.
The fact that this conversation, it's uncomfortable, but it's a good thing that we're going to start having it. But literally that happened, Thursday of last week, Friday of last week, so it's new. It's new.
Kind of hijack the learning focus.
I know.
I don't know if hijack is the right verb.
Took an
We
interest.
built off of it.
Yeah.
We
Exactly.
responded
Exactly.
fully.
We were very interested in.
Do you have more
in-
though because
Well-
we kind of went off there.
No, that's
It was
all.
done.
Well, I mean, these are definitely some common themes that we're, struggling with, and we're glad that the administration is paying attention to them.
Mm-hmm.
And we understand the community challenges associated with it. And, the other challenges too.
We're leaning into the health stuff, the health curriculum now. You can't do that fast. You have to build a coalition around it.
Yeah.
You gotta take your time, you gotta do it right, or else it's gonna be done wrong.
Yeah. And you'll never do it in a way that will satisfy every
Right.
last
Right.
community member.
Right. He's got the right people on the team. He's got really concerned people on the team, so he'll do a good job with it.
Excellent. Are we ready to move to Becca and PK and Act 66?
Mm-hmm.
Great.
All right,
Can I introduce you?
Yes.
you
You
can.
can introduce yourself. And
I was gonna say, hopefully I'm less controversial, but I'm loving the issue.
So this is Becca, and she is our regional coordinator with Winooski Valley. So prior to me, we were one of the very smart places in the state that when Act 166 came, the superintendents of the Winooski Valley said, we don't think we can handle this on our own. And if we're going to be sharing kids across districts at the preschool level, we need to have a common coordinator. So each of us pay a little bit of Becca's salary.
I'm owned by 11.
Yeah, she lives in Barry, she lives in Burlington, but her office is is the Harry Potter cupboard under the stairs in Barry, with John Pandolfo. So welcome, Becca, thank you for coming.
And I have to say, because I learned today that the Winooski Valley doesn't have anything to do with Winooski. It happens to be made up of the school districts around here.
Yeah.
Yeah,
Well,
well,
Winooski River.
there's the Winooski River.
Winooski River
Well,
runs through us all.
Yeah.
The
I
region
know.
doesn't correspond to the river either.
And to further, kind of confuse the issue, what I've learned, so I'm a new employee. So my background is, I've been an early childhood special educator, and then I went off and did a whole bunch of really consulting and professional development, working with providers, so working with people who work in childcare. Did a lot of developmental screenings, did a lot of systems work, graduated from ECLI, so did the Snelling system for early childhood. So I'm relatively new to the team. I started the day that the big kids went back to school in August. So a few months into it. The piece that really confuses the situation, this is not gonna click for me. The piece that really confuses the situation is that Winooski Valley Superintendents Association only exists when the superintendents who are in the association are talking about it. It's not a standalone legal entity. It's a group of people who talk about it because we need a shorthand conversation. So Libby was so kind as to, one, issue the invitation with you all, but also kind of give me some talking points in terms of information that you may or may not know about Act 166, that you may or may not know about preschoolers in the WVSA and within the Winooski Valley Superintendent's Association. So you do have, there's a couple slides that are hard to read with the numbers and everything, and I didn't know what people would walk away with. And as Libby can attest, I'm one of these people who's not shy about saying, like, I have no idea, let me get back to you, and following up with you. So feel free to jump in and ask any questions. I did put my, where you can find me, Harry Potter under the stairs. I love that. All my contact information's on the front of the presentation, so feel free to reach out. I'm pretty consistently reachable. So the Act 166 education law is the universal preschool law in Vermont. It basically funds any child who's 3, 4, or 5, which is a little quirky, we'll talk about that, by the kindergarten cutoff, so by September 1st, to fund up to, well, to fund 10 hours of preschool in a 35-week period. It's paid for through the ADM money and kind of divvied up by the school districts, which either pays for your in-house program, it pays for a Montpelier student who might go to attend childcare anywhere in the state. So it's kind of this, like, I say that I wrestle octopuses all day. And parents have that choice, so parents can choose which of those options they want to do. So the agency that really defines pre-kindergarten, there is a pre-qualified program, that pre-qualification process that all of the providers, school-based, home-based, child care center-based, have to go through. There's an enormous list of things that the AOE says, you know, you have to have a licensed teacher on site, or if you're a home-based program, consulting to you. If you're a school-based program, the teacher has to be in the classroom during those instructional hours. There's definitions around funding. The AOE is constantly sending out kind of clarification memos and pieces. A couple have come out this week. But they really start from the premise that what we're trying to do with this law is really increase high quality education. So really thinking about their definition is really high quality and effective instruction, licensed educators, which is key, using evidence-based practices, intentionally designed, aligning the curriculum with their early learning standards, and really this piece about inclusion and access. For those of you who aren't familiar, the early learning standards are a continuation or the start to the grade level expectations and learning standards that we talk about at the upper ages. Does that make sense, kind of as where we are placing us? There's about 659 kids throughout the Winooski Valley region who are tuitioned outside of their home district school-based preschool program.
I have a quick question for you.
Yeah.
Where does AOE define this? Is it in the rule that they define that, or is it?
It is, I don't know if it's actually in the legislative law. It's on their website, and it's on all of the taglines that they send to everybody.
Yeah.
So it's fairly well publicized and out there. I don't know if it's actually in the legislation.
I'm just wondering.
It might be in the, there's currently legislation that's in process. The last one I read was the beginning of last week. It might be re-updated into there as well.
Do you know what that bill is off the top of your head?
I can look it up for you.
Okay, I'm just wondering.
Yeah, I can send the link to Libby to distribute.
Thank you.
It's pretty constantly updated. There was some testimony today. I know there's a full slate tomorrow. And it's really looking at, and we'll get into this a little bit more, but it's looking at the fact that the study, so the AOE said, let's do this thing, the legislature went for it, we've got this whole system in place. There was just a report published by an outside organization that does research, and it was just published in January looking at the 2017-18, so a few years into it, so like 2 or 3 years into the law. they were reflectively looking at whether it was working or not, so now there's all this traction and speed because we have the results of this research from an outside Vermont organization. So here's a pretty picture of where we are for the Winooski Valley. So Lamoille South, Lamoille North, Orleans Central, Orange, Berry, White River Valley. What's not on this map, because this is the map that I had them in Central Vermont. What's not on this map, because this is my already thinking of moving our publicity stuff towards 2021. Twinfield and Cabot school districts have been with us for this year. This was their transition year, so they're going back to Caledonia with the rest of kind of that reconfigured school district. But they've been with us for this year. So I do lots and lots of things, but this is the when you look at the job description, this pretty much sums it up. What I really do is I act as the liaison between whoever's providing the preschool services and the school district folks. So every school district, every supervisory union, all 11 of them have somebody whose job it is to coordinate the local level. So Tracy Locke is the person for Montpelier-Roxbury. So she's the person who, if a parent brings a question to Montpelier, she kind of frontlines it and then moves it, kind of either to Libby or to finance or to me and hits it that way. We also coordinate on the paperwork. It's my job to make sure that whoever's providing the 10 hours a week of public pre-K has their insurance and their licensed teacher, and I go out and I visit them and I do some, on-site and off-site monitoring. I make sure that, there's policies they're giving to parents. If a parent's unhappy, it usually comes to me first. And then really in terms of designing the publicity pieces, the programs all enter a contract. We just got it back from the lawyer. The superintendents are going to talk about it on Friday. So really that sort of stuff is all wrapped into what I do.
Can I ask you, I think I might be missing a piece.
Oh, no, that's
Why
okay.
does this, if there's really, the districts are a funding district for the positions of coordination, right?
Correct.
They're not really, there's no boundaries within the state in terms of the mobility of families to put their kids wherever.
There is, but they're going away under the new proposed. Okay. So right now, and I think it's only one.
Yeah.
So the law affects every preschooler in this state.
Yeah.
Within our group of 11, who holds that local district position is the curriculum director or the special ed director or sometimes the principal. So it really varies who that person is. So the idea of my position is really that I have the time to do this. The school districts can apply under current regs, can apply to the AOE in order to say, we don't really want to pay outside our boundaries. As far as I know,
right.
The only one is the Rutland corridor.
Right. Okay.
And in the new bill proposal, that's we're done with that.
Right, right.
And
Because the
that's not
districts were able
option.
to make those decisions on their own originally.
Initially, yeah.
I remember that. Okay, so then I guess the last question of that is,
No, that's good.
does there need to be local people in your position? What is it, why not have the AOE do this? In other words, and I'm not trying to, I swear I'm not trying to eliminate a cost.
Well, that is the funniest thing you've ever said.
No, I just don't understand why this needs to be organized locally, not necessarily even regionally,
Right.
but why does every school need to field these questions if it's a statewide system?
Right. So
They don't have
I think a couple, and those are that yes, come testify. Not that I don't want my job. I'm very happy
Right,
in my
right.
job. So I think there's a couple pieces to it, right? So in terms of local people and my position, I definitely, we need to have people within the district who are identified as the people who kind of like, because the kids all register as Montpelier-Roxbury School District students. So I get their names, but I don't do that stack of registration paperwork or move that or put it in Power School or in SIS or any of that stuff. In terms of the state, I think the piece introduced into the conversation before we talk about capacity, the piece to introduce into the conversation is that for preschool age children, not preschool, including preschool, but not just preschool, for children who have not yet reached school age, who are in this kind of, quasi land before we get them in kindergarten, they have to work under the child care licensing regs, which is the Agency of Human Services. For programs who are providing public pre-K, universal preschool in this funding model, they also have to straddle the Agency of Ed. So right now, they have to follow both sets of regs.
That's your next slide.
Is it? There we go. So, which is a challenge, and which is addressed in the new bill that I'll get you the link for. So there's this piece of 2 ownerships. There's only about 5 people in the early ed department in the Agency of Ed, and so regardless of this particular program, there's not a stable enough workforce, and there's not the number of people. They don't have the capacity. In the new proposal, the proposal that's out there for the bill is really looking at, would we kind of, I had a call with all the local district people today, and somebody said, well, in the divorce, so in the bill there would be a division of kind of this dual oversight, and right now the proposed bill has the Agency of Ed taking that role, and has in it the structure that they would increase the monitoring, they would increase, like, all of those pieces we just talked about what I do is in that proposal.
Well, isn't another big thing that it's not mandatory?
Right.
You don't have to go to preschool.
I can choose as a parent to send my kid
Which is
or not.
different than everything else the AOE takes care of.
Exactly. Well, and I think, part of the conversation that those of us who live and breathe early ed is, the dual oversight is a problem, but Agency of Health and Human Services are really the people who are so used to looking at all of those other pieces around care of young kids, right? You get a 3-year-old who goes to Union Elementary's preschool program, and kindergartners are still babies, but like they're not the first grader who walks in who can be independent, that, kind of that same piece we were talking about different developmental needs at each level. So there's a lot of conversation. Does that?
Mm-hmm. I mean, that's an efficiency, but I was looking at why does each district need this, but I get it. I mean, they're registered at the district level, so they're students of the district.
Right. There's some ownership of them.
Yeah. I get
Local
it.
control, Steve.
What's that?
Local control.
Well,
It's a funding mechanism too, the way it flows through too, so that's the other piece of it.
It's a
I
funding
think we
mechanism,
count
it's local
them too.
control.
Yes, we do.
Right?
Yeah,
we can.
Yeah.
To equalize the,
Right.
what,
Yeah.
a
The
quarter
fraction
of
of
people.
one.
So there does
They're
need to be some.
0.46
As of right now,
as of right now, right, still to be
determined.
discussed in multiple bills,
So we.
because they're only 10
money,
hours
we
a
give
week.
money
Yeah,
back.
no, it's okay. That was the piece I'd forgotten about, was that it comes through the school district.
Right.
Yeah.
And you don't have a choice as a school district about participating in it
Sure.
or not.
Yeah.
You have a choice about, do you want to run your own program?
Yeah.
But yeah, and so, kind of as an interesting piece, the Waterbury Stowe Morrisville is our biggest kind of line of number of students. But the greatest number in the WVSA, the greatest number of providers are actually up in Chittenden County. So that question that you were asking about, like the do we know why, is really around parent workforce.
Yeah.
And also about the fact that Roxbury doesn't have any community programs that are eligible, right? And Montpelier has, you know, many more than many other places, but it's also a piece. So another challenge to implementing is that this comes through as a local funding mechanism, but it's funded differently and separately from special ed services. So if you have a student who lives in Roxbury who receives special ed services, it doesn't have to cross, the special ed services don't have to cross the district line. So when you think about like, how am I funding this? What we know from the report that was just done, the study that was just done, is that most children with special ed services actually are enrolled in their home district's school-based preschool program. And then there's, you know, always the question of parents refusing services. We know that low community program numbers, so are there availability of spaces that are Act 166 qualified, that if we don't have those program numbers, that's when we tend to see more public pre-K, publicly housed pre-K. And then licensed teachers is always an issue. So the WVSA does not issue provisional licenses based on a whole lot of pieces, including the fact that like Libby's not gonna sign off on one and go to Chittenden County and supervise a teacher in a preschool classroom. So, you know, and that's the reality across the state. It's a reality in terms of the messaging that's out there for, you know, private preschool programs, child cares, are, you know, in desperate need of having teachers who are qualified, who are licensed. But we have 3 school district programs that are, you know, on a shoestring right now and trying to cover maternity leaves and don't have licensed teachers within those programs. So it's not just a community-based problem, it's a school problem as well, as I'm sure you guys see at the other ages. But that's also that's a huge reason why we don't have more community programs that are pre-qualified and can do Act 166.
So provisional are not allowed, or is it that they're not required?
They need to be they need to have on their teacher's license an endorsement in early childhood or early childhood special ed. We as a WVSA superintendent's group, because of the method of like, who do you choose and how do you supervise them, doesn't sign off as the signing off body on provisional licenses.
But
so
if we had a problem in our program, in-house program, could we have a provisional?
Oh, yeah, in-house is
Yeah.
different than
That we can
out of house.
Okay.
In-house, we get provisionals all the time.
So that we can supervise.
Yeah, absolutely, but the challenge becomes, if, I'm not gonna sign off on a provisional for somebody who doesn't work for us.
No, right.
Because
right.
they're basically working under my license.
Yeah.
You know?
and it's not a living thing, it's a like, it's
No, I
it's
get
a
it, yeah.
management.
Yeah.
Well, this was an issue we had at the very beginning of
Yes.
this, because we
Yeah.
were asked to take on provisional licenses, and there's no reasonable way for our superintendent to supervise
Supervise.
and evaluate and
Mhm.
so forth.
In a
Well,
program
and
we
there's-
have no control over,
Yeah.
Right.
in effect.
Right. And the AOE has just put out based off of the testimony that they just did, they just put out their new monitoring system. So hopefully there will be some AOE pieces. Right now, if I hear about if I hear through the grapevine, or if I happen to stop in and there's an issue, that's the monitoring that takes place. There's not, just like Libby's not in every program, I'm not in every program every day. We have about 60 partner programs, both, if you're counting the home-based, the school-based, and the center-based. So just a quick thought on that free and reduced lunch, who's accessing the program. I got these numbers from Tracy, who talked to the local people. So at Union, there are 2 3-year-olds and 7 4-year-olds in the program who are who are receiving free and reduced lunch, who are eligible for free and reduced lunch. And in Roxbury, there's 1 4-year-old. And those numbers pretty much are balanced in terms of actual student enrollment in those classes. The Union Elementary's in-house has 15 students in the AM and 15 in the PM. And the morning program is a collaborative between Head Start and the SU. And Morgan is owned by Montpelier-Roxbury School District. She's a school district employee, and that was based on that Head Start couldn't find a qualified teacher. So Morgan and Brenda co-teach those 2 classrooms. And then Roxbury Village, Dottie has 17 students that are enrolled within that program. So those are your in-house public preschool based numbers. And then I'll talk about the community in just a minute, but just a quick note on that special ed to go back to those challenges. Montpelier, Brenda gave me these numbers. There are 3 or 4 children, both in the morning and afternoon classes, so combined they average 3 in one program and 4 in the other, who are solidly on IEPs and receiving special ed services within that program in their regular classroom at this point in time. There are 5 children who are Montpelier-Roxbury residents who receive services in their in-district boundary Montpelier preschool programs. So does that make sense? So like over at Montpelier Children's House or over at Montessori, because they're in the district boundaries. 4 kiddos in those community care and education programs are currently being evaluated, so that also boosts your numbers, but also talks to the really great collaboration that the public school and the programs, especially in this area, have going on. And 1 child is served as home-based services on an IEP. And in Roxbury, there's 1 student who's currently going through the eval process. So again, those numbers kind of line up with where our kids who are receiving services. Just a key piece about Roxbury. There are 9 preschool age, and I got these numbers from Let's Grow Kids. So there are 9 preschool age spaces at Kangaroo Kids Care, and then Linda is a home-based child care. Neither of those programs are AOE pre-qualified programs to provide this Act 166 service. So they're not, those 9 slots plus Linda's, depending how our numbers are not public pre-K, universal pre-K funded slots.
And are those available slots or filled slots?
I don't know if they're available or filled, but they don't meet the pre-qualification.
Okay.
Because they don't have a certified teacher.
Because they haven't met all of the criteria. I honestly am not familiar with this program. Okay. I don't know, do they not have a teacher? Do they have licensing violations? I do know that the data I got from Let's Grow Kids, Linda only has 1 star, and you have to have 3 stars in order to even enter the process. So I do know that that's the piece around her program.
There's a lot of building requirements too. You have to meet.
Yeah.
Are you just talking, this is the universe of what's available?
This is the universe of what's available. So in Roxbury, you have 9 spaces that are for 3, 4, and 5-year-olds, and then whatever Linda's kind of home-based care,
So
right?
figure 10 total or whatever.
Right, 10 total that are not eligible to even talk to me about forming a partnership.
And 0 that are eligible.
And 0 who are eligible,
Okay.
so
The
you
public
have
for
a
public
program.
school.
Of course, yeah.
And the 17 in the public
Yeah.
program. So in Roxbury, I did, and I'm totally understanding, I'm from Burlington, so the whole geography thing is a little mucky to me. I get that 10 miles is not, could be a really easy drivable distance and could not be, depending where you were talking about. But if I go into the child care registry and do Roxbury pre-qualified programs 10 miles as my filters, there are 13 programs, only one is pre-qualified. It's Spring Hill School and it's in Waitsfield. And Kira, I texted her on Monday. She has 27 slots, they're full. She anticipates that they're already full for next year. So that just kind of gives you a kind of lay of the land. Libby had said, like, is there a lay of the land we can give them for childcare capacity, Act 166 capacity?
That's good.
Does that make
Yeah.
sense?
Mhm.
Okay. And then I did the same, and here are the school-based programs that are within 10-mile radius. So anyone, but within 10 miles of Roxbury can go to these. Braintree and Brookfield school-based programs are not through their Act 166 pre-qualification yet. We're working on it next week. So those are not listed, but probably would be available for next year as well. So these are the public preschool. And remember that anybody in the state can go to any of these.
So can Roxbury preschool kids come to Montpelier public program?
Yeah, so they can go anywhere in the,
Can we establish geography preferences? How do you do that?
you can't establish, you can for special ed, you can't for Act 166.
So how
You
do
could-
you deal with too much demand?
You can choose to serve your home kids first. So you can say, Union Elementary has capacity for 30 kids. We're only gonna serve residents of our district, so that would include Montpelier and Roxbury, right? We're only gonna serve these kids. We're not accepting outside tuition, and you can do that. But you can't,
Beyond that, you can't qualify.
you can't say, our Montpelier kids can only go in this geographic
No,
area.
but can we
Does that
say,
make sense?
you know, we have 30 positions, or,
Yeah.
and we'll take, you know, and
And
we have
20 of them are
25
gonna be
kids are,
Montpelier.
okay, you can do that,
Yeah,
okay.
you can do that.
You can do that?
Do any of these have excess
I
capacity?
think we have a lottery, so we have more demand than supply.
Yeah, we have a lottery to get in, because we have more kids that want
Right.
in.
Right, I'm
Right.
just wondering, does anybody have excess demand in the public?
No.
Okay.
Excess
Excess
You
supply,
mean
sorry,
excess
excess
supply.
supply.
Excess supply.
Yeah.
No.
Okay, yeah.
They're, you know, I can tell you from experience, because I sit in my little cubby hole, the Berry person sits with me. Berry City is over capacity in terms of kids at that pre-K. Berrytown is looking like they're gonna have like 3 spaces that we know aren't full for next year. But that probably doesn't mean that they're actually available. There are 59, I ran the same filters, there are 59 programs for Montpelier. 8 are pre-qualified. We work with all 8 of those programs. They have active partnership projects with us. One program is religious and it's not eligible for Act 166 tuition because it's public school funding. So a program that's affiliated with the Catholic schools is not eligible to receive the tuition. Does that make sense? And
And-
there are your,
And again, to rehash, the pre-qualified programs, what differentiates the pre-qualified from the non-pre-qualified programs again?
so pre-qualified programs have to go through, the AOE has a pre-qualified system.
Okay,
So it's basically that you're using Teaching Strategies Gold, so you're using the assessment tool that we require. You have a licensed teacher, and the variation of like what does that mean for a requirement differs on what type of program it is, but you have a licensed teacher. There's some pieces around like your handbook has to have, you know, kind of the inclusion, the, you know, not refusal, you have to agree to work with your public school.
are there any financial differences between pre-qualified and non-pre-qualified?
There are some
Schools.
building requirements.
And are there any legal,
There are,
like, for example, is there a cost difference, or a funding difference? Like if we have more kids going to pre-qualified,
Well,
pre-K.
kids can only go to pre-qualified with their
with their
voucher.
tuition.
Okay,
So
that's what-
my kid
okay,
can
that's
only
what-
go to a pre-qualified program if I wanna ask for the money from the school district. if I just wanna send my child because it's a voluntary program, I can go wherever I want.
But
And-
you don't get the money.
But
from
you
the
don't get the
district.
money.
So if all
So-
the pre-qualified supply is full, then
Correct.
is there any mechanism to provide families with money or no?
No.
Okay.
So the money travels with the child. So if a child starts in this location and moves to this location, any tuition that they haven't attended for yet goes to that new place. It's a set amount. I've been working on next year, so I apologize, I don't have off the tip of my tongue this year. Next year, it's 3,445. And so parents get that chunk of money spread out. The school districts all pay invoices on a monthly basis. And the WVSA does it on a reimbursement system. The school districts up north of us all prepay the programs and then kind of figure it out and rebalance throughout the year. The WVSA school districts, so this piece, all say, okay, you were enrolled by September 4th, you're billing me for the, services and weeks the kids attended from September 4th to, October 1st, we'll pay you back for that expense. The law says the tuition has to be spent directly for the child, and it has to, it's not Montpelier writing a check to the family, but it's Montpelier writing a check to the program who has to apply all of it to the education. That doesn't mean that the $98.43 that the program is getting for that kid for their 10 hours is anywhere near the cost of 10 hours of early care and education. So programs still set their own prices, but it's a huge help. Did I just muddle the issue, or did you get
A little
it?
bit, but I can follow up.
Money goes with the kid.
Money goes with the kid, but only if they go to pre-qualified programs.
Exactly.
And the pre-qualified programs are all full, so
They're not all full necessarily.
They're not all full
The
necessarily.
public ones
The
are.
public.
Yeah.
the public
Public
ones
ones
are.
I would say, this is part of the child care crunch. Like, this is the effect that as a school district, we feel when you hear all of those conversations about like, talk to your legislators, there's not enough child care. This is part of it. So there is space in some of the school-based programs. I think if you were to look at a list of what we have for public programs, and you think about the amount of young children that you have in an area,
I have one question.
yeah, no, go for it.
Way back on free and reduced lunch too.
Yeah.
You had 9 kids, which if we had 2 of our grade level classes, that would be 160 kids, and 9 out of 160 is only 5%. So that doesn't correlate at all with our free and reduced lunch population.
Our preschool program's smaller though. It's not as big as our typical grade level.
Okay.
This is
So
the
there's
school-based
9
program.
kids
It's
out of
only a
30.
quarter, right? So
Because
it
this
would
is your
be-
school-based.
So it's a third almost.
So one of the holes in the
Especially higher
data,
than our,
So, well, it would be
Yeah.
like 15%.
Well, if it's 9 out of 30,
yeah.
it's almost a
Okay.
third of it. So our free and reduced
So
is,
that does align.
yeah.
Alright.
Well, it's
I was
higher.
I was
It's
wondering
higher.
if we
It's higher
needed
than-
to do something, but.
Yeah, it's higher than, yeah.
and there's holes in the collection of data. We don't have some districts within the WVSA, some districts not, collect the free and reduced lunch forms, and some don't. So we don't actually know, I don't know what those 9 is out of, how many free and reduced there really are. That question is
Oh, out
specifically
in the
of-
community.
Right.
Right.
Because it's not necessarily a data point that they collect.
Right.
So we're working on,
So-
that's one of those pieces that I want to.
I have another question on the funding. So my understanding is that what is the Waitsfield School District called?
Harwood Union?
It's Harwood, thank you, Harwood Union.
You're welcome.
My understanding is they have a pretty robust pre-K program, they have a public pre-K program. correct?
They have publicly housed pre-K programs. That's always the language, right? Because it's all public pre-K, but it's not public pre-K in the conversation we're having. They have Act 166 school-based programs in all of their like elementary schools. So you're looking at one location, whereas they have multiple locations.
We have two
You have
locations.
5
You have
elementary
two,
schools.
right.
But they, my understanding is they're doing a pretty good job of meeting the demand.
They're doing a pretty good job. Don't quote me on this number, but I was doing the like how much people are gonna pay towards this for next year. I was doing that today. They have, I don't know how many they have in-house, but they also have 116-ish kids, that number's like sticking in my mind, that they tuition out to other places. So I think they have high capacity, good system, and I mean, to some extent, really savvy, educated parents as well. And a force where a large percentage of their kids are enrolled out of district
For pre-K.
community childcare.
So here's the other thing to consider, remember, we're the anomaly about growing population of kids. In other districts, that's population has dropped, they've got the room. If we wanted to run another preschool, we don't have any place to put it.
Physically in the building.
In the
Right.
building. So that's why some districts have more room to run more preschools, because they have the room to put them in.
Berry School District has 127 kids in-house, but they run the equivalent of 8 preschool classrooms,
Yeah.
right?
And
They
there are
run,
two,
they have 2 schools, they run 4 classrooms twice a day, times 2. But they have a huge number of kids, and, you know, Lauren's like, we can't steal any more room from, like,
Right.
they are capped out, they're just capped out at a different number than you are,
Right.
in terms of space.
And we have how many?
30.
Pre-K?
15 at a time.
We have 30
You
spaces,
have,
but
you have 15 in your morning Montpelier program, 15 in your afternoon program, and 17 in Roxbury, but I think Roxbury's program can fit a little bit more than that.
but we have Montpelier kids that are going to the other.
You have,
Oh, yeah.
right,
Do we know how many we have total for Montpelier
I can pull that number for you.
and Roxbury? I'd be curious to know.
You mean going
That's
to
it.
private?
Total total
Oh,
pre-K.
there's a lot more than that,
eligibles.
yeah.
Oh, yeah.
Yeah,
Is it
We've
time?
got a lot,
Yeah.
because we have a lot of choices that are
Yeah.
pre-approved.
and I have that number, I can pull it for you.
Locally.
That's an easy number
The
to
public
pull.
is just a
Right.
very small part of meeting the demand, but it's really important for the special education too, especially.
Well, and it's important to have the balance in classrooms, right? We don't want those 8, 9 kids on IEPs to, like, we don't want our publicly based preschools to be the default
Just, yeah.
for the children who are lower income and receiving special ed services. So I just wanna get through 2 more slides, and then I could stand here and talk about this all night, cause I'm so passionate about it, but I wanna recognize things. So there's a couple of ways that we know if this is working or not. I did a family survey that I sent out. The quick down and dirty, because you can read the slides, I put them in. The quick down and dirty is that it was sent out to somewhere between 800 and 900 families. It was sent out via SurveyMonkey. Some school districts, yours included, chose to send them to your in-house kids. Some of our WVSA school districts didn't send them to in-house programs. We, as far as the WVSA, got about 450, it's not an about, got 450 responses. Which, like, I walked into John's office and I was like, oh my God, and he goes, I'm watching the emails flag in, because it's his account, right, so he gets the updates. 450 was huge. It was a 14-question survey. It went out via SurveyMonkey. And then programs, if they asked, I sent them the paper copies and they sent them back to me and I entered them. The overall response is that people are really happy with this program. They want longer hours. They want more support financially. And then the kind of identified, like, was it easy to register my kid? Because they have to register with you and enroll somewhere else, right? So unless they're in a school district program, you get all the registration paperwork, they do all the enrollment with their program. So the quirkiness around that is something that the school district individual 11 people and I are working on and have spent months putting into practice heading into next year. So we'll see how that goes. Quick down and dirty on the teaching strategies. So at its most basic level, when the legislation initially went in, the legislature said we need to have beginning and end data because we don't know if this works. We don't know if preschool works, which of course, like all us early ed people were like, well, of course it works. Kids develop. But this is how we're measuring this. It looks at 38 different learning standards and objectives, and so the children's skills are scored on a continuum. Next year when you invite me back, I'll be able to give you some real data. The data right now is you can't compare this year's fall to last year's fall because of the amount of school districts that changed and the towns that changed within them. It's really mucky data, and I question its validity. But I have it if anybody really wants to talk to me about it. And then the kindergarten readiness surveys. So I just threw up here kind of some of the who responded. There were 72 respondents from Montpelier. So there's an idea on your ages. People are mostly finding out from your website. This is Montpelier data. This is not WVSA data from your website. And then, you know, kind of in decreasing, it's that community networking, and then their community programs. Poor little AOE website had one. This is
You can't find anything on it. It's like the worst website ever.
I do the link all the time because I'm like, I have no idea where to find stuff. And then, you know, I think this is pretty substantial that out of 72, we've got 35 who agree that this process was easy and strongly agree. And then I pulled out, these are regional. I didn't have a way of sorting it to be like, the Montpelier people are saying this. But this is kind of, these are thematic around the piece. So I just pulled some of those out for you. And like I said, I am so passionate about this, I've probably talked way more than you wanted me to, and I'm so sorry. But questions?
Any surprises in the data?
In the data from the family survey? Yeah. Not really. The pieces that came up were really in line with the challenges that are coming up in all the studies. They're coming up in those conversations with people. And then the other pieces around the data in terms of kind of what people are thinking and want to see are really particularly around registration. It is so complex. I don't have kids, but it's so complex to think about the fact that like your 3-year-old, you know, in March now, when they turn 3 in July, you're already starting to talk about school registration, but they're staying in their same childcare program. So it's like, it's very odd as a family to do that process. It's cumbersome. Like I said, we've been working really hard, this team of 11 and I, for the last, like this has been my push, is if we want to give high quality childcare to kids, we need to make it as easy as possible for people who truly care about their kids. Like you care where your kid is, you care about the people who, you know, educate your kid, but it's only the one little piece that Jim was talking about your life, right? So we've been doing a lot of work around simplifying processes and getting standardization between the 11 of the districts.
What's the state doing to get more certified preschool teachers?
They, as terms of AOE and state, don't seem to have any initiatives they're putting out there.
Great.
I mean, is pay an issue?
Let's Grow Kids and the Vermont group of the National Organization for the Education of Young Children, Association for the Education of Young Children, are working together and working with VSAC, and both in terms of grants and VSAC funding are really pouring as much energy and money into it, but you've still got, you know, the 20-year-old with no degree who wants to do this, but she's got a child at home and she's working full-time because she needs to work, and can't go to school and balance it, and then you add in the cost of school. So there's a lot of, like, really, everybody recognizes the problem, but pouring money in it isn't gonna solve the situation
No.
either. So I'll get the bill.
Is it the one that was introduced last year?
They've made, they introduced it last year, had some motion on it. We thought that they were going to start from what they were working on, but they actually revamped it. And so it's a new bill that has many, many iterations. The last one that I saw was the 12th of February. So I'll email you the bill and you can disseminate it. I'll get you we wanted to know the number of tuition for Montpelier students.
I think it would be helpful to know the total number of pre-K students that we have going to pre-qualified.
Okay.
That isn't Montpelier. I'm really curious to know for our lottery, what are the total number? We have 30 open spots, but
Actually, Grant would know that too, he pays the bill, right?
How many people are trying to get in?
yeah,
How many
people
people
are trying
want
to get in?
Montpelier?
I mean,
don't know
anecdotally,
that info, but
part of,
Tracy might.
I had inquired with Libby a couple of times about pre-K stuff. This is generally to the board because I live in a community of young families, and I'm of an age where I have a lot of friends who have young families. And one thing I hear from them, the primary thing I hear from them when they're like, "Oh yeah, you're on the school board. Like, do you think we could expand our pre-K offerings?" And I'm like, "I don't know anything about our pre-K offerings." So,
Well, now you do, and you can
yeah.
say, I had this really confusing presentation, but
Well, no, it's good. There's just a
she
lot of
rocked
information.
it,
Yeah,
so
yeah.
I know who to ask the questions to.
The answer is no, because we don't have space. We
Yeah.
can't expand because we don't have space for it.
We'd have to build a new building.
Or, you know, rent some space from BCFA who might be interested.
But you have to have, Tina's right, there's
Yeah, there's a
significant
lot.
building requirements because of the HSA.
Yeah, it's a high entry cost.
It's
We had to redo the
Oh my
rooms
God, yeah.
at Union so that they could preschool rooms.
Yeah.
There's a lot of
It was a
requirements in a
project just to be
preschool.
able to do that.
Yeah,
Yeah.
I mean.
Well, and
you just can't
it's
stick 'em
really
anywhere.
this developmental age thing where it's not the first grade that I can, you know, and totally, like, I know
You're
it's
showing
not
your
this easy.
bias.
My background is in elementary ed, but it's not as easy as we have books, we have students, we have a teacher, we have tables,
Yeah.
right? I mean, those kids have to wash their hands when they enter. They have to wash their hands after they use the bathroom. They have to
to
wash
be
their
contained.
hands before, before snack. They have to wash their hands
In a
whenever they
special
touch the
teeny
pet.
tiny sink.
Right.
Yes.
And they're little, right? So there's
And they run off,
there's
and-
huge
yeah.
infrastructure cost to it.
And what do you know what pre-K educators get paid compared to?
Depends where you
K as
are,
well?
depends which program
not
they're in.
much.
So it depends which program they're in.
They're
Um,
never paid in the public
Yeah,
program.
because they're under the teacher contract.
They are,
Oh,
they are better paid in the public schools because they're on a teacher's contract, but it also, like, you also get benefits and vacation and health and dental and retirement, like you're a teacher contract package. I was paying, as a director of the Y, I was paying my licensed teachers $17 an hour. With, you pay me back $3,000 for benefits, there's no retirement fund, and guess what, here's your stack of personal days, you can use them or not use them, but it's your sick time, it's your vacation, it's your personal time.
Which is less than we pay our school staff.
Yeah,
It's-
and
yeah,
Head
it's-
Start doesn't pay, I mean, Head Start pays along those lines, but yeah, they're probably bringing down somewhere between 20 and like 25,000. It's miserable. And, you know, we have to be really careful about the conversation that we need to increase for everybody. There's nobody new coming into the field. I can tell you this, like being a well-networked person for the last 24 years, there's nobody new entering early ed right now. We're really looking at people who are moving from program to program in search of a better environment and in search of better benefits.
That's why we need to train more people.
Right.
Yeah, but
Right.
who wants to be trained into a profession that underpays for really tough work is what I'm getting at.
Right,
And has limited capacity in the public schools.
Yeah.
right,
Which is a statewide issue that
right.
Yeah.
All right, so I'll get you program community numbers. I can work with Tracy to figure out the lottery numbers, and I'll get you the link to the bill. You guys have my info. I'm full-time, so reach out and connect. And I just sent like a 1.5-page email with all of the links around registration for next year to all of our partner programs today. Kind of a missing gap between school day and here. So all of the materials are ready for next year. So if you have questions or you want to see them or check them out, email me and I can link you into those. They're all in Google Docs.
So helpful,
Thank you.
thank you.
Thank
So
you.
that's so helpful, thank you.
Yeah,
Yeah.
thank you,
Always,
Becca.
and
Super
if we
helpful.
missed, if Libby and I missed anything with the brainstorming, let me know. And thank you so much for allowing so much time and conversation. And like I said, I'm passionate and it's important.
So now we are having a little celebration and saying thank you and farewell to,
Oh, do you want to do the calendar too?
oh, we need to do the calendar. Let's do the calendar first and then we
Then
can
we
say
can
thank
say
you.
thank you.
And farewell to,
Just first read, 24th to 16th, underneath.
So.
do I have a motion to approve the calendar as amended and set forth in front of you?
So moved.
Second.
Second.
All those in favor?
Aye.
Any opposed? Nay. Great, thank you. We have a calendar.
I'm sorry, the rest of the consent agenda was approved.
Yes.
Yes, so we are all good.
Now.
Now, yeah, so this is the last meeting. We'll have Michelle and Tina with us as board members. You're always willing to drop by. We have public comment
We'll
period
call about that,
every
Michelle, and
session.
coordinate.
Comment 6:30, every Wednesday.
Yeah, yeah, but I would say thank you both. You've both been here before I was here, and it's been wonderful working with both of you. And I think I speak on behalf of all the board, and I say thank you for all your time and effort. I know you both have worked extremely hard over the years and accomplished a lot of great things for the district and great things for our kids. I think the schools are much better off as a result of the effort you've put in, the leadership you've shown on the board. So big thanks for me, and I think we have some sort of treat.
We do.
And a couple cards I have yet to sign.
Oh.
We are so organized. So Tina, Michelle, thank you on behalf of Montpelier-Roxbury. Come on over.
Did you bake that?
I worked all day on this. All day. Maybe searching for a
There's
knife was
flour
all
all
day.
over our office. And
That's right, that's right. And as a special thank you too. We thought you might need some relaxing time with a good book.
Thank
So,
you.
Thank you very much.
Thank you very much.
Yeah, I don't know what I'm gonna do with all my.
Thank you for all the work that you've done.
Basket it.
So we could take the cake into executive session.
Yeah.
Make sure you get a piece.
Um, So I think we need while we're doing that, why don't we have a motion for negotiations?
All right, I move that we find that discussing contract negotiations in open session would put the district at a disadvantage. Is that what you need?
Yes.
I
And-
second.
Yeah, and then do we want to add a quick discussion about huh?
Oh, about,
There's a board personnel
Two contracts?
discussion
And personal evaluation? Yeah. Just, so motion to go in for those 3 reasons, the executive session? Oh, first of all, we
you
need,
need to vote on that
we
motion.
need to
which is
vote on it.
different
Did we have a
one.
second?
Yes,
I did.
Michelle seconded.
Okay, all those in favor?
Aye.
Any opposed? Okay, now a motion to go into
So
executive
the
session.
motion is to enter executive session for the purpose of discussing contract negotiations, personnel evaluation, and board personnel
Yes.
discussion.
All those in favor?
Aye.
Any opposed?
I'm not sure there
I'll
was a
second that.
Tina second.